Anxiety and depression seems to be the most prevalent mental health situation that people would come to counseling for. And I guess it bears a lot of discussion to understand these two topics, its concurrence, what it means to people's lives.
Yeah.
So what would be our take on this? How are we going to help this huger population of people who are grappling with this?
Okay. How would you?
I think the first thing is make them calm and understand what they are, what's the situation or what status they are. And then we will, as a hypnosis therapist, normally I will try to dig out where it's come from, what trigger it, and whether we can find out the root cause. If not, then we try to, shift the status, make it lighter, or the behavior not really disturb the client's life, day-to-day routines and all that. Then we slowly find a way to get them better, make them happier.
So for me, when I work with clients with anxiety and depression, I think when they first came to see me, it's about their bodily symptoms. They couldn't sleep, they feel heartbeat is beating fast, but people struggling with depression could be, I feel really empty, I don't have a meaning in life. So I work around conversations around the symptoms first, then I go deep. Yeah. What about you?
I like to try and look at the anxiety part first, because I think to deal with anxiety, you have to make them feel safe.
Oh yeah,
that's the very
for
first
sure.
step. Once you make them feel safe and they can kind of bring in their reasoning part, then they're better equipped to deal with the anxiety and the depression. So getting them into that state is like a prerequisite for any treatment.
That's a good point that you picked up, because in a lot of times when you listen to people when they come to counseling, there is often a lack of this sense of safety.
Yes, exactly.
And so because they don't feel safe, the expectations of life may be unreal, or they may not know what to expect of life. So naturally, this itself will spiral them into this anxiety.
Yes, I agree. And then a lot of time I feel our client, before they come, please hug yourself and give yourself a hug.
Acceptance.
Acceptance. Whatever you are doing is good for your benefits, and then you are doing very good job.
Yeah, but I also work with clients with a very warped definition of safety, because safety to them is I am in control. I need to know what's going to happen so that I feel safe. But the act of asking a lot of questions to get that certainty can make people around us feel really suffocating sometimes.
Yes, it's not like you can wave a magic wand and make them calm down, which feeds back to something you said. It has to be gradual. You've got to get small wins and then build on them, because you have to crawl your way out of these situations.
Yes.
You can't jump out of them.
And it is informed by life experiences,
absolutely.
what they have lived. And it has created this, sometimes even the fear. And truth to be told, what safety may look like, as you alluded to, what safety may look like to one person may not be the other person's safety.
Yeah.
Ironically, some people feel safe in an abusive relationship because this has been their, it's familiar. That's the norm they have been with. And they do not know that they are actually in an abusive situation. If by then you offer to them a supposed calming, embracive, inclusive relationship or this is danger for them, and they'll push away.
Yeah, that's a very good point. I often do that with clients. I kind of draw a target. In the center of the target, I have, the safe zone.
Safe zone.
Then the next one is the growth zone, and then the next layer is the danger zone. And then I like to relabel them. Yeah. And I always relabel the safe zone as the familiar zone to make them think about it differently. Or for some people, the stuck zone.
Oh, yes.
The zone that they are stuck in and are unable to move out of.